Just waiting for the go ahead, and I just got the go ahead. All right, good afternoon. Today is December 2nd, 2020. It's Wednesday afternoon. I have Dr. Isaias Irgau with me. We are going to discuss smoking and alcohol use before and after weight loss surgery. This is a really important topic because as we are going through our cases, we do discuss this with our patients, and we wanted to make sure that this would be a great opportunity for our patients to hear and listen directly from Dr. Irgau, from our surgeons, so that we can provide as much support as we can. So as I mentioned, I have Dr. Irgau with me. Dr. Irgau, if you can please introduce yourself.
Thank you, Kemal. Very happy to be here. I'm Dr. Irgau. I am the president of CHRIAS, Christiana Institute of Advanced Surgery. My area of specialty is bariatric surgery or weight loss surgery. And CHRIAS is a surgical practice that specializes in weight loss surgery. We are by far the most experienced group in weight loss surgery, having been performing weight loss surgery for almost 20 years now in our area. And we have really set up and established centers of excellence for bariatric surgery in our area, including the area's main health centers.
Thank you, Dr. Irgau. So I do want to also share our other surgeons who are part of the program. Other than Dr. Irgau, we have Dr. Gail Wynn, Dr. Mike Peters, Dr. Rose Singh, Dr. Sachin Vaid for colorectal, and Dr. George Ibrahim. And also our surgical PA Sydney is part of our program. This is a partnership between CHRIAS and American Surgery Center. Many of you who are following us, you already know the facility and the program very well. So this is, I believe, our volume 14. These are our dietitians who are part of the program, and you see them from the beginning and to the end of the surgical process. Fran, Amy, and Beth, they are wonderful, and they support all of our patients during this time. So, Dr. Irgau, we wanted to discuss the smoking and alcohol. Now, even today, if I was put on spot, it's a difficult answer from a non-clinician standpoint. So we wanted to hear from you directly what it is that patients should be doing, what they should be, what they're expecting, what we are expecting during this time, before and after. I know it's a pretty lengthy topic, but we just want to kind of cover as much as we can.
Absolutely. So thank you, Kemal. This is indeed a very important issue. When we are doing weight loss surgery, we are not only changing the arrangement of the digestive tract in a way that is very beneficial for the person to lose weight and become healthy after surgery, but we are introducing also changes that will affect the interaction between the digestive tract and the rest of organs in the person's body. So any interaction with the environment after weight loss surgery obviously is going to be different. It's going to have an impact on how the weight loss surgery will proceed in the future. To that extent, particularly looking at smoking cessation and alcohol intake habits is very important. We have obviously focused on this area to evaluate the patients before surgery to see if a person has a history of smoking, current smoking that is, and if they have a history of alcohol intake and how much intake is that. Clearly, there is a big difference between somebody who drinks alcohol socially versus somebody who drinks alcohol on a daily basis, perhaps at larger quantities than they are usually expected on somebody who uses alcohol occasionally. It's very important for us to ascertain that. Let me tackle each issue differently. Let's talk about smoking, for instance, first. So when you are preparing to do not just weight loss surgery, but any type of surgery where general anesthesia is involved, smoking cessation is very important, because a person who is currently a smoker and undergoes general anesthesia, they are likely to have more complications from that anesthesia, from that surgery, than a person who is non-smoker. These complications can include things that, like pulmonary complications, the development of pneumonia afterwards, to things like poor healing of the tissue because of the smoking. So smoking cessation is very much recommended by surgeons across the board for any type of surgery that requires anesthesia. But for bariatric surgery, there are even more important reasons, right? And those involve what happens if a person, for instance, were not only to continue to smoke to put their own surgery in danger, but also what will happen to their organs if they go on smoking. Well, for instance, if a person, for instance, has gastric bypass surgery where there is a connection between the stomach and the intestine that is constructed by the surgeon at the time of weight loss surgery, that connection itself is very vulnerable to something called ulcer formation if that person is a smoker. The ulcer that form in that area become very difficult to treat if the person continues to smoke. And ulcers can be dangerous. Not only they are painful, not only they make the life of the person miserable every time that person eats, they will have pain, but ulcers can actually bleed, causing a life-threatening condition. Ulcers can actually burst, causing a life-threatening condition. So smoking cessation is extremely important for somebody who is undergoing evaluation for bariatric surgery.
So, Dr. Gill, do you mind just repeating that once again? So for not the surgery itself, but for bariatric surgery, it's more important. Just that part, can you just, if you don't mind.
Absolutely. So Kemal, if you can actually bring a slide of gastric bypass, for instance, if you have a slide or of all the procedures, I can, and then you can point with your arrow particularly to gastric bypass. Essentially, when we are dividing the stomach and then connecting the stomach to the intestine, we're forming something called an anastomosis. That's a connection between one portion of the digestive tract to another. That connection is very vulnerable to formation of an ulcer. An ulcer is really almost like a wound that occurs in that anastomosis. Mm-hmm. If an ulcer occurs, we have treatment for it. We have anti-acid medications that we administer, and the ulcer will heal if a person is not a smoker. If that person is a smoker, the ulcer will not heal afterwards. And as I said, the ulcer will make the life of the person really miserable, but also it puts them in danger because complications of that ulcer include ulcer perforating, which is bursting, and the ulcer bleeding. Sometimes the bleeding can be so much that it could be immediately life-threatening for the person. So it's very important for anybody undergoing weight loss surgery to stop smoking completely and forever. Obviously, the other biggest advantage is that if a person stops smoking, all the diseases related to smoking also are not going to be there, whether it's lung disease, whether it's cancers affecting the airways or the oral cavity. All those obviously are going to be diminished if the person can quit and quit forever. Now, we know patients, for instance, when we talk to them about, particularly our patients who are coming to us to lose weight, they tell us that they continue to smoke because if they stop smoking, their appetite will come up and they will gain weight. We understand that. We understand that quitting smoking sometimes can lead to some transient weight gain. But from our point of view, because we are providing a very powerful tool for weight loss, which is bariatric surgery, the benefits of quitting smoking by far outweigh any other consequences that they may see because they have quit smoking. So quitting smoking is very, very important from that.
Is that definitely the case when you smoke, you eat less? Is that, or is it just psychological?
No. I think there is an appetite suppressant effect of smoking that people who have quit smoking have observed. They stop smoking, and then they gain a few pounds afterwards. And this is almost, almost everybody experiences and, reports that. But what we're saying essentially is that, yes, you may struggle with some weight gain, and we will help you because we're here to help you control your weight. But more importantly, we are on our way towards a process that will help you lose a large amount of weight, which is bariatric surgery. So
I'm going to ask you a specific question, and
sure, of course.
I apologize in advance if it's not the right question.
No problem.
So if I'm going through a bariatric surgery process, and
Yes.
I was a former smoker,
Mm-hmm.
and let's say if I didn't smoke for the last 8 weeks,
Mm-hmm.
right, and then I had one 3 weeks ago, but I had one. So what do I do? Just stop the process and then just restart? Or is that like we want to make sure that we know the risk, but like we are not stopping the process? I just like for patients to understand how important this is. So I want us to just repeat that.
We will actually postpone the surgery, Kemal. It's very important for patients to understand that abstinence is categorical. It's very important. So remember, smoking is a habit, right? We want to get away from that habit. And it's very difficult sometimes to negotiate 1, 2 versus, 5, 10, or quantity-wise. We are talking about a habit that has to be removed completely. We don't want any type of nicotine to be there at the time of the surgery. So we are fairly strict on this issue, Kemal, and by far the vast majority of patients are compliant when it comes to.
When we say smoking, do we include everything, Dr. Irgau, like the cigarette smoking, but there's also some medical marijuana and.
So that is a separate issue. That's very important. We're talking about nicotine right now. Nicotine is the main issue that we're talking about, and whether it's recreational use or medical marijuana, it's a separate issue. There is not as strict a guideline about it as there is with nicotine. By far, the vast majority of patients that we encounter really are nicotine users. So it is the nicotine that we are most concerned about.
Now, we know the smoking is bad anyway, so regardless of the surgery.
Absolutely.
So we want to stay away from smoking before and after. And I also want our patients to really hear what we are trying to do in these sessions. So like this week, we probably went through, we'll finish probably about 60 patients' charts. And when we work with our care coordinators, they have difficulties communicating with the patients, and it's not something that they are initiating. This is given by the surgeon from our program. So then it's also same for all surgeons. It's a standard way of doing business. So our patients should hear this clear and loud and clear, so that it's not something that is negotiable, so that they should be really, and we'll support them as much as we can from our side, but we need them to stop completely smoking before the surgery. It's 2 months, right, Dr. Irgau? 2 months before.
Absolutely. Yeah, I think, studies have shown that even if you were to do 6 weeks of abstinence, the benefits are still there before the surgery. So clearly what we are saying here is there is nothing punitive about this. It's not about, punishing somebody. The issue here is do the right thing so that the surgery is safe for that person. That's very important. Our number one principle as physicians is first, do no harm. That's very important. So it is important that we mitigate all potential factors that could cause complications, that could cause harm to the patient, and smoking clearly is one of them. So that's why as we have time to prepare patients for this surgery, we're saying to them, look, let's decrease any influence that could be negative towards the outcome of your surgery. And with smoking, we understand that, because it's not only an issue for the actual surgery, but it's an issue also for after the surgery. Look, some of the happiest patients I've had, Kemal, are patients who used to be smokers when they came to see me, and they had morbid obesity. When we're done, a year after their surgery, they are thin patients and they are former smokers. What a wonderful situation to be in.
Yes.
Very, very happy. Absolutely. They have
Really.
transformed their trajectory of their health completely.
Yeah, absolutely. So now we took the smoking out of the equation. So now we have the drinking. So let's talk about that a little bit. So is it also similar to the smoking where I have to stop drinking for so much time
So,
for surgery?
so there are obviously two different situations. So if there is somebody who has an issue with habitual drinking, almost towards addiction, almost that they have to have alcohol, that is a problem that has to be dealt separately, right? Because that issue of alcohol dependency is a major issue that we would need to resolve and address through referrals to behavioral health and to our psychologists, and that has to be dealt with. In terms of social drinking of alcohol, which is far more common, obviously it's all about education, right? We want to educate our patients about two issues. One is the fact that alcohol is calories, right? Whenever they're drinking alcohol, they are actually decreasing their ability to lose weight effectively because those calories of alcohol come in. And then more importantly, another issue that is perhaps less known is that alcohol actually increases appetite, right? When people feel full, but then they drink alcohol, they end up eating more. So it's not only the calories that you're taking from the alcohol, but also the increased appetite that alcohol invites that gets people to struggle with their intake. So understanding this is very important, right? So that knowledge will prepare them better for afterwards in terms of avoiding things that will sabotage their weight loss process after the surgery. The other issue that is obviously very important is particularly for procedures like gastric bypass, right? Where we have a very small stomach connected directly to the intestine. People who've had gastric bypass will have a much bigger effect with a smaller amount of alcohol compared to before their surgery, which means that a lot of alcohol can rush into their digestive tract and then to their liver much more quickly than before the surgery. The stomach, with its size, actually acts a little bit like a buffer so that the alcohol that is drunk is slowly absorbed into the liver. After gastric bypass, you don't have such buffer. So the alcohol can go into the liver much more quickly, and the person actually can be in danger of developing severe liver disease, even with smaller amounts of alcohol. So particularly patients who undergo gastric bypass must understand this. Now, there was a time in which we as bariatric surgeons, particularly when we started bariatric surgery, close to 20 years ago, our policy was absolutely complete abstinence of alcohol. What we understand now is that it is okay to drink alcohol moderately, knowing that the amount of alcohol that the person had before their surgery may be way too much, even in a social setting, when they look at it after the surgery. So if they were drinking a glass of wine before, in social occasions, now they have to do half a glass perhaps. So, and that has to be occasional. It cannot be a regular habit for the reasons of calorie intake, but also for reasons of potential damage with excess alcohol into the digestive tract so quickly. There is another element I would like to tackle, Kemal, and that is the issue of addiction of alcohol. And that issue is very relevant for our bariatric patients, particularly for patients who were on the borderline of taking excessive alcohol intake before the surgery. If they were habitual drinkers, they really needed to drink alcohol on a daily basis. Well, what is that problem? Well, the problem is that if you have an addictive, relationship with alcohol, and somehow you took care of that by, dealing with stress because you by drinking alcohol, dealing with stress by eating more food. After the surgery, food will be less available because you have a much smaller stomach. So you could concentrate all your energy now to deal with stress just by drinking alcohol, and that's a far bigger problem. So for people who actually drank too much alcohol, I personally suggest no alcohol at all, because just there is a danger for them to slide back into that situation.
So, Dr. Irgau, this moderation, like I do have wine glass in the office, so don't judge me, but this is 1 glass, but when we talk about 4 ounces, right? So
yeah, absolutely.
Our followers already know about what's in here.
Yeah.
So this is maybe the moderation, right? And it's not wine, but it looks like wine. But
no. That's your lemon and lime.
Ginger, cucumber, and mint.
Cucumber, yeah, I know.
So
yeah.
This is the most in the moderation. So I mean,
absolutely.
Sometimes we see people like with bigger glasses, and then they fill up the glass. So this is not moderation. So
this is not moderation at all. No.
Right, so
you should be drinking water in a quantity like that, never alcohol in a quantity like that. Absolutely.
Because sometimes we're not seeing it. We have the same issue when we are going through these in the diabetes program. Like every time you have to measure stuff, it's way different than the way that we think it is.
Absolutely.
And it's important for them to kind of see, for our patients to see.
If I may, I could add another issue also, Kemal. So obviously, alcohol is not only wine, right? So it is important to understand that, spirits actually have a much higher level of alcohol even. So those are actually areas where I don't want any of our patients to entertain, So I do believe that if they are to drink alcohol, probably the better option would be red wine. To tell you the truth, red wine does have some other benefits as well. Again, it has to be in absolute moderation and for people who don't struggle with some type of habit forming history with alcohol, essentially. So spirits would be out of the question. And then obviously there is beer. Remember, beer is carbonated. That is also a no-no after weight loss surgery. So if you have to drink alcohol, choose wine, and even that has to be in moderation after weight loss surgery, because you don't want to be struggling with excess calorie intake. You don't want to be struggling with opening up too much your appetite, and you don't want to obviously put yourself in danger by rushing too much alcohol into your liver, which can happen after weight loss surgery.
So, Dr. Irgau, while we are going through these, and then we discussed the smoking part of it, alcohol, but there's also some patients who are struggling with substance abuse on the narcotics, the prescription medication, or the actual drugs. So how can we help those patients before the process of, during the process and before getting the surgery?
Yeah, so active substance abuse is a contraindication to surgery. In other words, if somebody has active substance abuse history, they cannot have bariatric surgery. That is why all our patients have to be evaluated by a behavioral health specialist as well, to make sure that if there are these issues, these are also properly addressed, right? There are some substances used recreationally or otherwise by people who actually are very dangerous if they have been taken and then the person goes under anesthesia. So we need to know about those, and we need to make sure that there is appropriate referral and help before we can do bariatric surgery. Remember, we're not saying, because you have this history, we're going to punish you by not doing surgery. That's not the intent here. The intent is these habits and this surgery in combination are a dangerous thing. We do not want that situation. So we have to address this beforehand. Not to mention the fact that those substances by themselves, even without surgery, actually have deleterious health effects, right? So adjusting them is actually in the interest of the person as well. So of course, those issues have to be addressed before surgery as well, Kemal.
Absolutely. Now, as we are going through the pandemic, one of the perhaps the benefit of the pandemic was we were able to emphasize the telemedicine.
Yeah.
And with the telemedicine, part of the form of doing providing care changed. So we started having more of these sessions, and I am pleased to tell you today that we have our YouTube channels are doing really good. So this is an updated playlist. One, this side is for the bariatric cases, the different live sessions that we are doing, and then on the other side we have the specific, some of the specific videos that we are sharing. Now, between the three channels, Dr. Irgau, CHRIAS, United Medical, and my personal one, we are over 700,000 minutes watch time, which 90% of those are bariatric. So I think one of the big benefits of what I see is for those patients who aren't really going through the process, they are watching this and then they are seeing the benefit, and I'm glad to see the results, and then I believe we are going to be able to do more. Now, we are not having any difficulty coming up with the topics, content, because we have daily case conferences. So in fact, the smoking and alcohol use was an issue coming up time to time, and we said, well, why don't we just discuss this in this live session? So I think you provided so much information that's extremely helpful. So what I'm envisioning is our patients who are going through the process or who's done with the process, if they feel like they need more support or help, they can watch these videos and refresh their knowledge or learn about what they should be doing and what they shouldn't be doing. And hopefully we can.
Absolutely, absolutely. So, you know, this is really an expansion of the space of education for us, right? I mean, when I see patients in the office, I have a one-to-one conversation with the patients where I try to pass on all the knowledge I have in order to increase their understanding of what the indications for weight loss surgery are, what type of weight loss surgeries we do, what the expected commitment is for a successful outcome after the surgery, right? Those are on an individual basis. But when I invite them to come to these sessions, I'm expanding that option for them in terms of time and also in terms of topics. I saw a patient today that came to see us. They were referred for weight loss surgery. Their body mass index was greater than 40. They had comorbidities that included high blood pressure and diabetes. So they were definitely a good candidate for weight loss surgery. The weight was just too much for them, and they've carried it for too long, and it's clearly having an impact on their health as well. And this is a person who really tries very hard, exercises as well, but like for many, many other patients, the weight was just not moving in the direction that they needed it. That's why they were referred. But at the same time, they were not ready really to proceed with weight loss surgery. So we had the conversation about the indications for surgery. We had the conversation also of the fact that weight loss surgery is not something I can order or prescribe. It is something I can recommend, but ultimately the patients have to be comfortable with the idea for them to go ahead. It's not something we can impose on them. And that's the conversation. But then I invited them to come to sessions like this to really expand their knowledge. They were open to seeing our nutritionists to do, non-surgical weight management in the process as they think about this, or they try, additional avenues for them to try to control the weight and their comorbidities. But this option was great. We did not have this option. I could not tell them before, go and watch this session so that you can have more knowledge. Now we have that. So this is really very, very impactful. Not only for individual patients, but for all the community that we are striving to serve.
Absolutely. Dr. Irgau, again, we are taking you guys away from your patient hours while we are doing these, but more patients are benefiting from this as well. So thank you for joining us. Now, next week, I'll be back with another topic. This Friday, we have United Medical ACO event live session, which is more generic on the COVID-19, the updates on vaccine. I don't know if you heard that, but today in England, they actually start giving the first.
I heard. Yeah, that's wonderful news. That's great.
Vaccination. So we are updating our patients, our population in these events, and Friday one is going to be at noon, and then we'll be back next week on Wednesday, same time again. Again, thank you so much for joining us, and we'll see you